at 6:30, so let's begin our meeting of the Tiffin Community School Board. I've asked Mr. Ankrum to lead us in the pledge.
I pledge allegiance to the flag of the United States of America and to the republic which stands one nation under God, indivisible, with liberty and justice for all.
Thank you. Consent agenda items, which includes tonight's agenda, approval of the minutes for regular session July 14th, 2020, special session July 30th, 2020, approval of claims for payroll July 17th, payroll claims July 31st, and accounts payable for August 2020. I'll pull the personnel report out and vote on that separately. And we have a donation of $5,000 from RWE Renewables for COVID-19 relief. So I need a motion to approve.
So moved.
Second.
A motion and a second. All in favor, say aye.
Aye.
Thank you. The certified staff for the personnel report, certified staff is Tori Geiger, special education teacher, Tipton Elementary School. Jody Moore, special education teacher, Tipton High School. A transfer of Josh Ireland from kindergarten teacher to virtual teacher for 2021 school year. Courtney Jewell, transfer 4th grade teacher to virtual teacher, 2020-2021 school year. Lori Mock, transfer from 2nd grade teacher to virtual teacher for 2020-2021 school year. And Danielle Voorhees, transfer from technology teacher to virtual teacher for 2020-2021 school year. Recommendation of Amanda Davidson, special education teacher, Tipton Elementary School. And certified or classified staff, Jennifer Cox, is requesting medical leave beginning August 20th. Transfer Kristen Campbell, transfer from high school library assistant to elementary library assistant. Pam Porter, transfer from part-time instructional assistant to recess assistant. Amber Yates, transfer from recess assistant to instructional assistant. Recommendation of Bianca Stahl for Assistant Technology Director of this corporation. Megan Bates, Instructional Assistant, Tipton Elementary School. Kaylee Walton, Special Education Assistant, Tipton Elementary School. And resignation of Savannah Rodriguez, Cafeteria Employee. Bianca Stahl, Assistant Technology Assistant. ECA staff is Susie Reagan. Recommendation of Susie Reagan Walsh for Corporation COVID Coordinator. And David Maddox, boys assistant soccer coach. All right. Next up is the superintendent's report.
Director report here?
That was included in.
Oh, okay.
Okay, we obviously had our first day of school today with our staff. I thought that things went very well. Again, it's exciting to see our staff back, and I can't wait tomorrow for our students to come back. And again, just that echoing the thoughts of, we're all in this together. We're all trying to figure it out together. And I do appreciate, all of our teachers and staff and all the work that they've done to get us to this point, and look forward to getting the school year started. We had a device rollout yesterday, and I want to thank our administrators and staff that assisted with that. I thought that went very well. It was incredibly organized. Really appreciate our parents coming to pick up devices for those students that needed them. Those students that are on virtual and also on the white team picked up their devices. So again, really appreciative of all that and how that worked out. And again, the organization was just wonderful. We also had high numbers of our teachers participate in professional development on Thursday and Friday of last week. Really wrapped around the kind of the new normal in the teaching world, working with virtual technology to make the virtual world work just a little bit better. And so we're very excited that we had that many teachers participate, and we look forward to seeing how all of this rolls out here in the future. So again, really appreciate our teachers coming in to do that. We have girls golf that's going strong right now. I do want to congratulate Lucy Quigley, who is was the Kokomo Tribune Co-Athlete of the Week, so congratulations to her. Congratulations to our girls golf team. They've started out strong, and I think it's going to be a great season for them. And so that's definitely wonderful news. I did want to just kind of talk about a little bit, again, we're making a lot of decisions here, and I do appreciate the board, and I appreciate the board in their actions to go to the hybrid a couple of weeks ago. Again, I believe that our long-term success is really contingent upon our healthy staff, and making sure that our staff, they're healthy, they're able to get in and do the job and to stay healthy. So again, I appreciate the board for making that decision, and I really do believe that was the right decision to make, and we're going to keep our eyes on things and see how we can progress. Again, just to kind of let you know, in general, everyone, part of our reopening plan is transparency, and we want to be very transparent, particularly if we have students that are testing positive. And the way we're handling that is we're rolling that out in email to our parents and to our staff. And that's probably the most effective way for us to do this. Again, we can't really control who puts things out on social media, but we just want to make sure that we get the information out and that's shared, and we will do that continually as this pandemic progresses, and hopefully we won't have as many to do in the future. But again, that's really the process that we're trying to roll. So as soon as we get the information, and as soon as we know, do a little bit of contact tracing and try to determine, where the students or the staff have been, we will get that information out. Again, we try to do that as timely as possible. Contact tracing. I listened to Dr. McCormick this morning on NPR. If you had the opportunity, it's actually out on Facebook now, the recording of her. Really great conversation, and she really talked about the biggest struggle, and I do believe this is true for our schools, is really that whole contact tracing. We're not necessarily qualified to be doing this, but we're going to try to do our best. And I just want the community and everybody to know that this, we are put some strategies in place to be able to do that to the best of our ability, and we're hoping that we can do that because we just want to keep everybody safe. But that's a difficult situation, and again, we'll just do the best that we can and hope that we can communicate with the people that have been near those kids that have, or student or staff that have been positive, and move forward. Just one more quick thing. We are meeting next week with the TEA, and we're going to look at the certified appraisal plan. We do have to do some revisions in that plan due to legislation that passed last spring. So we'll be meeting to do that and rolling some of that information out to you and talking to you about that in our next meeting. So that's it.
That's his department report.
Second quick question. Sure. Did we end up at around 20% going all virtual, or do you have anything on the numbers?
We're about 20%. We're just a little bit over 200 altogether in the corporation. And so a little higher than I thought, but it's pretty much in line with everybody else. Yeah. So.
Okay. Department reports, you guys got a chance to look over those. Questions on those? Okay, next we move on to the financial report then. Dr. Glaze.
As you take a look at the financial report, we have a cash balance of $82,000 in our education fund. Debt service, we have $961,478 in debt service, and also in the operations fund, we have $2,345,787. Just in general, the education fund is The balance has moved down because we had a 3-pay month in July. And just as a heads up to the board, we will need to transfer again from the rainy day fund so that we're not going to be in a negative balance. So that'll probably be coming in the October meeting. So.
Yeah. All right. New business or old business to continue with. So new business, consideration of revised 2021 budget timeline. Mr. Imswaller submitted 2021 budget timeline in June, and it was approved by Tipton Community School Board of Trustees in that month's meeting. After discussion, the budget timeline should be delayed 1 month in order to have a better understanding of our potential ADM for the fall count. The original timeline and revised timeline are attached.
Yeah, essentially we're just doing everything with the budget 1 month later than what Mr. Winsweiler had proposed. Again, it just kind of gives us a better idea for budgeting purposes, and Amy and I are very diligently working on the budget right now, and but it'll just allow us to have a little bit more of a feel for where the enrollment will be. I guess historically Tipton has been one of the first schools to get their budget in. We'll probably be with the rest of the state on this particular situation.
First budget work session will be September the 8th, Tuesday. So keep that in mind. Next is consideration to approve a memorandum of understanding between TEA and Tipton Community School Corporation. Last year, Tipton Community School Corporation certified contract went through significant revisions to the ECA pay schedule. In that process, elementary coaching positions were left off. The error was not noticed until contracts were being updated this year. Memorandum of understanding was developed to add ECA positions back to the contract. And it is recommended that the Community School Board of Trustees approve this memorandum of understanding. So, motion.
So moved. Second.
Motion and second. All in favor say aye.
Aye.
Any opposed? Thank you. Next is consideration to increase Tipton Community School Corporation contribution to administrator and classified personnel health insurance premium. The negotiated contract for teachers for 2020-2021 resulted in Tipton Community School Corporation paying an increase to health insurance premiums. This last month, our insurance trust voted to increase insurance premiums by 2%. For administrators and classified staff, it is recommended that a 2% increase be provided to the Tipton Community School Corporation contribution for health insurance to match what was negotiated for teachers. The 2% would be an increase of $23,216 on that line item. Motion to approve.
So moved. Second.
Have a motion and a second. All in favor say aye.
Aye.
Any opposed? Okay, thank you. Next is consideration to approve board policy on first reading. Neola developed 2 new policies on the topics of face coverings and virtual education in response to COVID-19. Due to the timeliness of school opening tomorrow, it is recommended that this policy be approved on the first reading. Motion.
So moved. Second.
Have a motion and a second. All in favor say aye.
Aye.
Any opposed? Okay, thank you. Next is consideration to approve an amended textbook fee for kindergarten and first grade. Last May, Tipton Community School Corporation Board of Trustees approved 2020-2021 textbook rental fees. Since May, Tipton Community School Corporation purchased additional iPads so all elementary students can be one-to-one. It is recommended that the Board of Trustees amend the 2020-2021 textbook rental fees to include a $75 technology fee for kindergarten and first grade. So, motion for that.
Second.
Motion and a second. All in favor say aye.
Aye.
Any opposed? Aye. All right. Next thing up is other matters to come before the board. personnel is the 14th of September. Business fair building until October. Tomorrow is the first day of school with students. And mentioned before, the public work session for the budget is at 5:30 p.m. on September the 8th. Next is comments from the community. Mr. Hankin, you have a list for that.
I do. You need more microphone, or how do you want?
I'm going to get the
Okay. Matthew Higginbotham, come on down.
I'm good today.
You good?
Yeah.
Sure. Erica Newcomb.
Hey, that's me. Would you like me to stand or am I fine here?
Do you want a mic?
Do I need it?
Yeah,
I don't need it.
Okay, all
I
right.
don't need it. Thank you, though. I appreciate it.
Yeah.
I want to first say that I really appreciate the open communication, receiving the emails, things like that. I really appreciate it. In the past, I feel like things were trying to, or people were trying to keep things a secret maybe, or whatever, but I appreciate that. It shows that you guys as a school board, as administrators, are aware of things and are handling it. We don't need more information than that. You know about it and are working on it. So thank you for that. Second of all, the location of this meeting tonight, I didn't know where it was when it got moved. Maybe put that on the website, because I checked to make sure we were still having it, and indeed we were, but it didn't say where. So just a heads up on that. And then I have a couple of questions. First, let's talk about the contact tracing. That's difficult for me to say. Contact tracing. I'm very pleased with the plan that you have put forward and that we're implementing. I love it. But I need to know more about the contact tracing. Is there a team? Do we have someone dedicated to tracking this down? We were just speaking, April and I and Mr. Johnson, about like the health department is taking up to a week to contact people in the community. Obviously, time is of the essence with this, especially in the school. What's our plan for that?
Well, basically what our plan is, we have our COVID response coordinator. Essentially, so if we find out we have a positive case, we're asking A, that every classroom has assigned seats, and B, everybody's in alphabetical order. Okay? So that's very intentional. So we know if a student was in a classroom, we have an idea of all of the students that were within proximity of that student, and we're talking about students that are 6 feet or closer for more than 15 minutes. Also, we have to look at it, did they have a mask on the whole class period? Did they not have a mask on the whole class period? We need to find out that. So that is one of the ways that we are looking, very, very intently on that contact tracing. Where it becomes very difficult, and I'm not sure how we do this, is during passing periods, some of those other places, and basically that's just going to have to be some contact with the student and just kind of asking and trying to determine how that's going to work. And that's going to take kind of a village, I'll be really honest.
Sure.
That's going to take administrators, that's going to take some other folks just trying to figure that out.
Do you have a time frame that you want to handle that in?
We want to do the contact tracing almost immediately. As soon as we find out we have a positive case, we want to be able to do that as quickly as possible. Unfortunately, in some situations, if we find out after school's out, that might delay things just a little bit. But what we can do in that time period is alert our custodians to do some deep cleaning in the classrooms that we know that student was in. But we won't necessarily be able to contact families maybe until the next day within those classrooms, if that makes any sense,
Yeah,
just
definitely.
because they're just not known.
I guess it was just the timing of it. I felt like we needed to say, okay, within 42 hours or 48 hours, we need to have this handled.
And I think for the most part that will happen.
Okay, great.
I don't want to guarantee a time
No,
just
yeah.
because you never know the situation, but we're really going to try to do that as quickly as possible.
Good. Okay, my next question is about the health, physical and mental health of our teachers and administrators. I am concerned about the stresses on them, both physically and mentally. What are we doing for them, or what can we do for them?
Again, I alluded a little bit to that this morning. I mean, we have to kind of take care of each other, so we have to take care of each other with within the buildings, within our colleagues, and just taking care of what's of the whole issue that we're dealing with right now. We've had some informal discussions, perhaps with Fort County doing some additional work with us. I'm not sure whether that's going to go yet. We're still working on something like that. But again, I think it's just the idea that nobody's on an island.
Right.
We're all doing it together, and we're all dealing with the questions together, and it is a lot of stress on our teachers, it's a lot of stress on our staff. It is truly going to be a demanding year, and again, we're trying to be cognizant of that. That's one of the main reasons why we really haven't made a lot of changes. We're trying to keep things as steady as possible, so we don't have the added frustration of this is new, one more new thing.
Right.
And so we've really tried to make sure that that's happening. And so again, we're trying to be in control of what we can be in control of, and trying to back off on those initiatives. And again, we just have to support each other.
I think that's what, I was wondering if I know you don't need anything else on your plates, the teachers definitely don't, but I didn't know if you were like implementing a buddy system, or say, hey pal, you need a break, why don't you, something like that, or just teachers checking on each other.
Actually, I think that's a super good idea. We haven't really looked at anything formally, but that's something that we can consider.
I don't know, because I'm not in the classroom all day, but I just know at home I need somebody to call me and check on me, so I'm assuming that the teachers really need that right now. So
That's a great idea.
that's it, thank you.
You bet. Laura Satone.
Can you hear me okay?
Yeah, I'll bring the mic if you like.
No, I'm good, I think.
Okay.
First, I just wanted to say welcome, Dr. Glazer.
Nothing.
I'm glad you're here.
Thanks.
In this craziness, I'm going to have a chance to say welcome, so welcome.
Thank you.
Second, I just had a question surrounding what exactly, I know it's kind of we're going through it together, it's a new world for everyone, we're navigating as we go. What criteria are we looking for when we look to maybe go in person for the kids, or conversely, when we're looking at going all virtual? What kind of numbers, what are we looking for?
Well, we're hopeful that there's going to be some kind of guidance from the state in the next week or two about what that needs to look like. Right now, Marion County is they've kind of led the way in looking at that positivity rate. Their suggestion is, when you reach a certain threshold, you have secondary students in the hybrid model like we're doing right now, and try to keep our elementary students in school in smaller classes. So essentially what we're doing right now. And then there is a point where I think their magic number might be 15%, and someone will have to help me with that. Is that right?
That's kind of what I heard
I
from
think
the
the
health.
positivity rate is something like
Yeah, because it
that.
reflects more of her
Yeah,
immunity as far as you
Yeah.
can guesstimate
right.
what percentage of the population has
Right.
it. Yeah.
So that's kind of what we're looking for, and we're really looking at positivity rates, particularly with school-age children, and we're also looking at positivity rates with the ages of our staff. So those are two of the data points we're looking at. And right now, the numbers in Tipton are a little bit skewed because of a localized situation. So we kind of have to take that number out and then try to make decisions after that. But I hope that the state will come out and say, at this threshold, you need to go totally virtual, or at this threshold, you need to go to a hybrid model, or you're wide open and ready to go. So I'm hoping that we can get some guidance from the state. Again, if not, we'll figure out our own. So.
Yeah, because the health department has a grand total of 3 people.
Yes.
And I did learn from the city council meeting last night, I was there for another matter, but that they're looking to purchase one of those point-of-care testing to kind of partner with the hospital to help with the testing so that people aren't going over to Elwood to have, or various hospitals throughout kind of thing.
Right.
And I was curious about the recovered case numbers, because that's a big factor in when they're determining herd immunity. And they don't report those as much.
I do know that number. It's 70%.
Yes.
Heard that from
Yeah.
the health department today.
Mhm.
So, which is, I mean, again,
Yeah.
we would like for that to be higher, but that's where it is right now.
Yeah, and so they're having a lot of difficulties so I was glad to hear you say, what you said about moving forward and stuff. And I only asked the question of what the criteria is because, Tri-Central's in the same community with the same numbers, and they opted to go, the hybrid, but, every day in person kind of thing. So I've heard a lot of people talk about it, and I just kind of wanted to know where we fell in
Right.
that, spectrum of things.
Sure.
And secondly, it's kind of on another issue, but you read a lot about students and with the virtual and just the stuff that's lost. Some studies say kids already have lost 3 grade levels of reading and math. And you go back to March when we put all this in, we had to put it in place, but a lot of that new material was lost. I could tell you as a parent at home, it was just a struggle to get the assignment, checked, done, submitted. So I've asked the question, is there going to be any way to kind of identify those students, perhaps, or maybe provide some extra something to kind of help with that gap? And I would, and I know that we're still proceeding with standardized testing, correct me if I'm wrong, as if it were a normal year kind of stuff, but I get concerned, when things like evaluations and stuff have a component of, you're evaluated based on test numbers, and I think they're going to be all over the place, quite honestly, because of this learning curve and learning deficit we already have that exists. So I asked that too on behalf of the teachers, and I know how fabulous the teachers are, because my daughter would not be in 6th grade today if it was not for those fabulous teachers. So I'm just leaving that there. But, I just kind of think about those things. How are we going to supplement that learning curve that's happening?
We're, to answer that question, we're being very intentional about not throwing kids into assessment as soon as they get back, because that's, in my opinion, cruel and unusual punishment. And so we will be doing NWEA testing, which is new this year. It has a nice growth component, so it can really show you when students are growing and making progress. And also we will get a RIT score for their reading level, which is very beneficial. And again, knowing exactly where kids are reading. So again, if that trend happens where we do have kids that have moved down, how are we going to address those skills in those needed areas? But that's going to be a little bit delayed until after Labor Day. But the nice thing about NWA is the data is instantaneous. You can get it the next day in most situations. And so we'll be able to look at that and determine how we move forward with kids with some remediation and with some reteaching. Again, it's the way the standards are written now. They really are a continuum. So there is a way to try to teach on grade level, but then backfill within those standards for the year before. Some deficits that could exist. I know our teachers are going to do that. But the last thing that I really want to do with our students is throw them on a software program.
Yeah.
I mean, to do something like that. So we're going to try to do it the old-fashioned way, just by good teaching. And so that's really the goal. But using that NWEA data to drive what we're doing. And so the good thing that came out of the legislature was that statewide testing is no longer tied to teacher evaluation. So that's a great thing. And so one of the reasons why we're meeting here next week to talk about the appraisal plan is because we're taking that out. So that's a good thing. And I don't know whether I-Learn will happen. We'll see. I mean, a lot of it depends on how the year goes. And again, that comes from the federal government versus the state level. And so we just kind of have to wait and see how that rolls. So,
Thank you.
you bet.
Rob Cochran.
I don't need a mic either. Anybody that knows me would tell me that. I too would like to welcome you, Dr. Glaze, is that
thank you.
correct? Welcome. I've been a longtime supporter of the school board and have got 2 boys that have graduated here and gone on to college. I have a 7th grader starting tomorrow.
Okay.
And one of my pet peeves is when people show up at meetings and try and tell me something about my job. So I'm usually pretty quiet at these things and try and be more of a Barnabas and be an encourager to people that are doing a really tough job for huge pay, I understand. But this happens to be my job. I am with Optum Healthcare, Optum Serve, doing the contact tracing, been on the governor's task force for COVID-19 since February. And at the last meeting, I just was really, really disconcerted about our reliance on data out of Marion County to be making decisions in Tipton County. I was disconcerted to learn that there was no epidemiologist, there was no data scientist on our task force here that I'm aware of. And we're just interpreting the data that the state sends out, which is known to be extremely bad. The number of false positives in these tests, we're going to be shutting down schools on false positives. And I say all that just to say there needs to be some other metric by which we're evaluating what we're going to do to go back to school. This data is bad, and I'm telling you, I'm in it every day. And so I'm not here to tell you how to do your job. I'm just saying, please look into something beyond. This data the virus is extremely bigoted, right? It will impact Marion County a whole lot worse than it will here, and we know why. Population density, ethnicity, all those different things, right? Those things factor into it. My concern, and I want to use the balance of my 3 minutes, is with my work with the governor in the state of Indiana and also with DCS, the national average of 25% of all child abuse cases are reported by a teacher. Indiana's number, if you want to look it up, is larger than that. We do a great job here of training teachers how to spot this. When our kids aren't in school, we're leaving them in harm's way. We're pretending that herd mentality or this herd immunity exists, which it does not. That's not proven in this virus. And I'm worried about the amount of damage that we're doing to children by not having them in the systems that we've created for them to thrive in. And so I just want to say that I've heard a lot about the teachers tonight, and I love the teachers. My son Austin's going to be at Taylor next year as an elementary teacher. He wants to come back to Tipton to teach. I've heard about the teachers not wanting to be here to teach because it's not safe. But I've also seen all over social media teachers in Florida and Disney and Miami and all these places that were hot spots. So I could go on for another 30 minutes about that, but I'm not going to do that. My concern is for the kids. I think they need to be in school. I think they need to be in school, and it needs to be done in a prudent and efficient way. And I'm concerned that the longer we rely on Marion County or whatever data that we're looking at, we're just hurting them beyond reading comprehension and test scores. And so the other thing I would say is contact tracing. There are federal dollars available. If you would have our local health department contact ISDH, there are federal dollars available to school systems to enhance, it's called augmented dollars, augment your contact tracing to help shorten that gap between the 2 weeks.
Okay.
So I'm sure that's the balance of my time, Jim. Sorry about that.
Thank you.
Thank you. All right, next on the agenda is...
Suzanne?
My question is, 6.4 on your agenda, the 2 new policies on face coverings. Can you give us some details about that?
The 2 new policies essentially is just taking what the governor has rolled out in his executive orders and putting that into our board policies. So essentially, it just talks about face coverings and what is considered to be a face covering. Also has some other other precautions. If you cannot use a face covering due to medical issues, then you can use it something different. So it just kind of has some protections in there. The other part of the virtual is the other part of that. It talks a little bit about how we count virtual students, how we have to take attendance with virtual students, and also State Board of Accounts rules for counting them in attendance. So essentially, all of those things are outlined in that policy for virtual students.
So with the attendance, that's why the students in middle school and high school have to sign in for every class every day.
That is correct.
I just have a quick question about the face masks. My senior here and I were discussing. Are we going to have the tipped-in face masks for sale, or is there a way to get those?
Yes, they actually are for sale. We rolled those out today.
Sweet.
So we'll...
I don't know if you guys saw what the high school kids got, but they're like these panty masks. I mean, my kids were
Everybody
dying
got those
laughing.
Everybody.
Yeah. Anyway, so
Those
I'm
were
going
the-
to buy a tipped-in mask.
Sure. They are the tan ones are the masks from the state.
The panty masks.
Yeah, they're but yes, they are for sale, and I know that I'm not sure if Dawn's in here. You're down there. What in the heck was I thinking? Yeah.
What's the scoop,
So
Dawn?
anyway, Dawn rolled that out today, and we'll put that on the website, and you
Okay.
can find out more information. I think they're $7. Is that right?
$7. Great. I got you, Dawn. Thank you.
Amy Cole?
Sorry, we just don't want you to talk again, Gary. Okay, so earlier you talked about the budget and you quoted the education fund and the operations fund. And obviously it was a 3-pay month, so your education fund is low because of that. Okay, so not recently, but say a year ago from now, the board was on a regular basis transferring a certain percentage out of that education fund into the operation fund every month because they legally could. All right, so that put your operations fund really big, and it kept the education fund relatively small. All right, to what avail, I don't really know, other than the fact that you can then take your salaries and divide by that total and say, oh, well, like salaries are eating up 95% of that education fund, which it depends on the total amount of money in that fund for that percent. So my question is, you said you were going to transfer money out of the rainy day fund, which obviously that's what it's there for. However, do you have an option to redo some of the money and expenditures in that operations fund and transfer it from there back into the education fund to cover those expenses to avoid touching the rainy day fund until you absolutely have to?
To answer your question, if you remember 2 years ago in the legislative session, the legislators are talking about the 85% idea that we need to be using 85% of the money coming from the education fund toward salaries. And then 15% of that would go towards operations, which would be, essentially paying the utilities, paying all of those different things. If you do not put 15% into the operations fund every month, you get put on the bad list. And then you have to go and talk to the state about why you're not doing that. And so it's a situation where it's kind of imposed upon us, and that 15% is something that just, well, when I was at Anderson, it was more like we had to do 20% because of, the way our taxes worked out. We had to pay for transportation out of that education fund dollars. We don't have to do that here, but we certainly have some other expenses that we have to pay out of those funds. Again, it's just kind of the way that they organized when they streamlined all the funds. And again, it goes way back to when they reorganized the way that, taking away essentially property taxes. And so now we get all of our funds for the most part from the state. It all goes back to when all of that happened, and that's how that amazing 15% came rolling out. And actually right now we're about 17%, and Amy and I are working on getting it down to 15%.
Can you legally transfer back out of that operations fund into the education fund?
I don't think so.
I was gonna say, there was at one point in time where you could make 3 changes or whatever, and I don't know if that was
I'll have to be really honest, Amy, I'll have to look at that. I don't know for sure.
Well, yeah, because they may
That
have
question's come up before.
rescinded that opportunity.
Yeah. I'm not exactly sure. I'll just have to find out.
Yeah,
Okay.
so I was just thinking if there is money to spare in there, it might be a good idea to readjust that and take it from there, as opposed to just continually every month that you are short pulling it out of that rainy day fund. So just something to think about.
Well, we're in the process of looking at some different ways of using the operation fund. So Amy and I are working on that now. So to try to protect more of the education fund. So.
All right. Thank you.